Hi again, Larry. I want to just kind of continue a conversation that we had very recently where we talked about an FDA report that was published linking for the very first time three patients who had a gastroscopic procedure and had tested positive afterwards for a rare strain of antibiotic resistant E. coli. And one of the things that you referenced during that discussion was a study back in 2021 that you had done that really relates to this conversation. I thought you could give us some more details about that study.
Yeah, actually, I did do most of the work in 2021, but I think I published it and I did publish it in January of 2022. And what I did is I reviewed about 10 to 15,000 FDA adverse event reports to understand about the true incidence of different types of flexible endoscopes, bronchoscopes, ENT endoscopes, urological endoscopes, colonoscopes, gastroscopes, and duodenoscopes, and to get an understanding of how many adverse reports were being filed with the FDA that discuss these six types of flexible endoscopes remaining contaminated or potentially remaining contaminated and infecting patients. And I found surprisingly that we might have concluded that duodenoscopes would be the real concern because of all the attention that they've received the last 5, 6 years. But I found that if first, when you compare the number of reports filed in 2021 to 2014 rather, you find that for all six of those flexible endoscope types I named, the trending data shows that the number of adverse event reports increased significantly for all six. And there are a number of reasons for that. For example, maybe just facilities are performing more procedures, and therefore you would see that the adverse event reports would be, you'd see an increase in them. There also may be an actual increase in the risk of infection associated with these devices. But what I also found is that when you look at the total number of adverse event reports filed from 2014 through 2021, I found surprisingly not duodenoscopes or maybe colonoscopes, but gastroscopes were associated with more adverse event reports in total filed since 2014 than any other of the other five endoscopes I looked at. So I think we need to keep gastroscopes on our radar. Those models also include gastroscopes featuring an ultrasound transducer, and these have a elevator mechanism similar to the duodenoscope, not the same but similar, and it's used to direct accessories, for example, a needle, if you're doing some type of sampling of tissue in the upper GI tract. So when I also looked at the alerts that the FDA has recently published, they have focused on three of those six endoscopes I mentioned. The public's aware that the FDA notified healthcare providers that reprocessed bronchoscopes, duodenoscopes, and urological endoscopes, that all three of those, when reprocessed, may still remain contaminated with multi-drug resistant organisms or MDROs. And the FDA did a very good job in notifying the public of this risk and making suggestions of how to reduce that risk. And in an upcoming video, we will talk about the recommendations and risk factors for those endoscopes to remain contaminated. But it may now be the time for the FDA to consider issuing a public alert notifying the public that gastroscopes too, after reprocessing, for a number of reasons we'll get into at another time, can remain contaminated and could potentially expose patients to these life-threatening organisms. I want to indicate that these MAUDE reports that talk about, let's say a patient is testing positive, that doesn't mean they're infected, they could be colonized. And the MAUDE reports are these FDA regulatory reports filed in the FDA's adverse event database, which we call MAUDE, that these reports may be incomplete or biased, but any type of an association between an infection and an endoscope is something we want to have on our radar and be concerned about, but it does not confirm causality. So in upcoming episodes, we're going to provide insightful recommendations for preventing these types of infections, and particularly risk factors that you may all want to be aware of that may make your endoscope, the endoscope you're using on patients and that you have an inventory, it may make them more prone to remain contaminated. I'll give you a little teaser. If, for example, the endoscope is damaged, not being fully or properly repaired according to manufacturer's instructions for use, we can get organisms deposited in those tears or in those sites of damage, and that can then place patients at an increased risk of infection. But that's more to follow and more to come.
All right, everyone, stay tuned. We'll be back with some risk factors and recommendations in our next video. Nice job, Larry. Thanks so much.